You found my podcast, MDSpin, on YouTube at Dr. Laura Beaty. Today, my guest is Angela Culbreath, a licensed professional counselor focusing on sexual and relationship health and wellness. So let's start with defining low sexual desire. So I looked up some statistics because I'm always the statistics nerd. It's not a fine stat. Between 40 and 70% of women will have had low sexual desire at some point in their life. Out of that group, 20% actually have a diagnosis of hypoactive sexual desire disorder.
That's right.
That's the DSM diagnostic criteria. You fit it. So low sexual desire, of course, can come and go. But for these HSDD people, it sort of is a shadow that they carry with them kind of always, and it really bothers them. That's a key. It bothers them.
Yes.
So I'm going to also talk about men, and then I'm going to turn it over to you to give us some more definition points. But 15 to 30% of men also have low sexual desire at some point. I don't think that there's really a diagnostic DSM criteria for them. Only about 1% meet that definition.
Right.
That does not surprise me, but
Mm-hmm.
I'm sure you work with this regularly.
I do. Yes. This is the number one thing that brings people into the office of a sex therapist is having low or absent sexual desire. That's the thing that we treat the most for individuals. And then when we're treating people in a couples setting, the most common thing that we treat is desire discrepancy, which usually means one person wants sex more than the other person. Sometimes they want different types of sex, but usually it has to do more with the frequency of sex. And often by the time people end up in a sex therapist's office, they've gotten pretty polarized where it seems like one person wants sex all the time and the other person wants sex never. And then we have to find the way back for that couple to meet in the middle, which is probably more likely where they were early in the relationship.
When all of the hormones were really pushing them to the intensity of that early sexual desire that I think everyone remembers and redesires.
Oh, yeah. I mean, it's a chemical thing, right? Like we're swimming in a chemical soup.
Oxytocin's up.
Oh, my gosh.
Norepinephrine's up.
Falling in love and losing your mind and whatever. That is what that era is like. And usually for 6 months to 2 years, people are coasting on the magic carpet ride of those chemicals, and things can feel really good. And sometimes in my office, that's what people want to get back to. It's like it was in the beginning. And it's helpful for me to know for them what it was like because that lets me know what their ceiling has been in the past. Some couples don't ever really have that magic carpet ride. Most do. And sometimes the bad news I need to give is that we might not get back to that exactly, but we can look at what happened after that. What happened after that 6 month to 2 year period? What were the norms maybe before other stressors came into the relationship, like mortgages and second jobs and children and sick parents and the sort of things that kind of crowd the plate.
Pull us away from sexual thoughts, for sure. And hypoactive sexual desire disorder, I think we'll spend certainly a subset on that. But since the majority of people that we're talking to and that hopefully will find us on YouTube are dealing more with the ebbs and flows of desire, I'd probably like to spend the most time talking about that and going back to what you see that causes it and some of the steps that couples can take or individuals can take. Desire discrepancy, I think, is also something that I see as a primary care doctor and have taken care of many times and just immediately had come into my head that maybe we can talk about later, but I'll put fake names to the people who are if there. But having the diagnosis of low sexual desire means that you're having less sex. Tell me what you think. Just not thinking about it during the day.
These are people that would say that sort of thing to me. It never crosses my mind. I think if he didn't want to have sex, we never would again. I would be okay with that. It just isn't a drive. It's like the appetite's gone. Some people miss it. Most people miss it. At least the ones that seek me out are missing it. But some don't. And then that, of course, gets us right into the questions about, is this been their norm is this how it's been for them forever? So that's some of the first stuff we want to know is it lifelong? And maybe they're trying to find something they've never found before, or was it acquired at some point? There's a better stage of functioning, maybe decades of it up until some point. And then also I need to know, is it generalized or specific? So does this mean there's no desire to masturbate? There's no fantasy about other partners. It's really absent in that person's entire body, like in their entire mind, or are they not wanting to have sex with their partner? And that's a different thing. So generalized or specific, that's something we need to know. And then lifelong or acquired. Those are different types of HSDD.
Let's dive into the acquired. So not lifelong, but what would be a standard encounter with a couple, let's say, that come to see you because all of a sudden there has been a change? And I think some of the most typical things that as groups of women we sit around and talk about and know that it happens, as well as seeing it in our respective practices, would be life-altering changes back to the point of multiple kids and multiple activities. You're in the top of your professional career. Your parents are aging, so you don't have the room for sex. I think when we talk about that,
Right.
and I'm gonna even make it talk about that woman,
Right.
we're talking about a high percentage of the periods of low sexual desire. I mean, I can recall when my daughter was little, having periods of really. I remember even talking to you about it
Right.
at friend groups, going, "Give me some pointers."
Right.
So
Right.
let's give them some pointers.
Yeah. Yeah. That's the getting your groove back kind of quest that a lot of women have. And actually, I think that we probably should just clarify for this conversation. Let's talk about low desire in women, because let's come back on a different day and talk about low desire in men, because low desire in men is a thing. And
It deserves its own time.
it deserves its own time, because it's not the same thing. It's the same way that in a lot of ways medicine women have kind of needed to fit into men's studies and such as that. I don't think that we should do the same thing here with low desire. Men who have low or absent desire suffer in a particular sort of way because they're men. And so I don't want to just kind of side note that a little bit here and there. Let's just talk about women with low desire today. We're probably going to be pretty heterosexist in the conversation and talk about women who have male partners, probably married. So those kind of words, let's just put some caveats to this. Those are probably going to be the kind of words that we use: husband, married, things like that. And we know that not everybody fits under that umbrella. There are people for sure that will hear what we say and they don't feel represented in that.
Right.
But a lot of people will. And then let's put a pin in talking about the men, because I really do think, like I said, that there's a special kind of suffering that goes along with being a man who does not want to have sex. So that'll be a different thing.
Tabled.
That's what that is. That's tabled. So for a woman who used to enjoy sex, who doesn't enjoy sex anymore, one of the first things we want to look at, of course, is, have you talked to your doctor about this?
Yep.
Because we do want
You, me.
Yes, exactly. Because a lot of times it can mean something, like something around thyroid or something around something else hormonally. You're the one that would speak to that.
Yeah, make sure that the boxes are checked. Thyroid's normal, hormones are normal. You're not on a medication that's potentially causing a problem that could be
Yeah.
tweaked or fixed.
Right? Yeah. The medication side effect is one I have to think about a lot.
So in this instance, let's pretend all ruled out, and I'm tossing them back to you.
And we've also ruled out pain, because that's the other thing.
Well, and pain, and I did want to definitely spend some time on that. From a hormonal standpoint, a lot of times for women, it is vaginal atrophy pain can be what starts the low desire process, because it hurts.
It hurts.
And then there are other women that have issues with vaginismus or just vaginal spasms that cause penetration intercourse to be almost impossible.
Right.
And I'm sure there's a large percentage of that group of women that eventually will fall under the low sexual desire.
Yes.
Because again, it hurts.
Right. That's
and
right.
It's hard to put your head around something that you would want to do that just is painful.
Right. So that needs addressing and making sure that gets ruled out. And I ask women those questions, and I'll talk about pain, discomfort, use a lot of different words like that to make sure that there's nothing like that that's a part of it. Because that's like putting your hand on the stove, right? Like, you don't want to do that again. We're wired to want to survive and pain, to avoid pain. And so if something is hurt, you're going to want to do it less. And then there's going to be more muscle tension and less blood flow and things like that go along with pain and guarding against pain. that creates its own cascade of effects. So if pain's involved, that's a different sort of treatment approach. But if pain is not a thing and there's not a medication side effect and there's not thyroid, then we look, of course, like, is there depression or anxiety, something like that, that makes sense of it from a mental health perspective. Then usually one of the first things I want to understand from a woman is, are you okay with your low desire? I get a lot of interesting answers for that. Sometimes very clearly, like, women will cry, be sad about, no, I really miss this. I feel like something is missing. That makes sense to me. I understand that. Other times I hear things more like, I would be okay if I never wanted this again, but I don't want him to leave me, or I'm tired of him being upset about it or something. If you could just help me want this enough to keep things okay between us. That's a tougher gig, quite frankly, to help somebody just want a little tiny bit or be okay a little tiny bit.
The case I was thinking of, I think this is an appropriate place to throw it in. I saw the couple, each as primary care patients, and I saw the man for his physical. They had been married a long time, probably 40 years, and he wanted to check his testosterone. His testosterone was a little low. He wanted to supplement. We started talking through all of that. And then, may I have I'm also having some issues with erectile dysfunction. We talked through that, gave him a prescription for Viagra, saw the wife maybe a month later, and she was livid. She was so upset that I gave him a prescription for Viagra and was putting him on testosterone, and basically said, if sex is a part of it, I'm out. And I was really floored. Yeah.
Yeah.
And their marriage was quite complicated, and I found out more about it at that point because I had a lot thrown at me, and I don't know where they ended up in their couple mess, but that was a challenge, and that one was kind of shocking for me. But when I look at it now, the number of long-term married people that go without sex is a pretty high number.
It's a pretty high number. I've long been told in my field, numbers that we toss around, it's about 20 to 25% of couples, long-term couples, don't ever really get out of that low sex, no sex category. And the way we think about it clinically is we consider it a sexless relationship, or no sex is if there's under 12 encounters a year, so less than once a month. And then we would put couples in the low sex category if it's less than 26, so really like less than twice a month. If there's no attempt at a mutually sexually satisfying encounter, we can't just call it sex, but like right. If there's no effort to do something fun together like that, then they put in those categories. And I think historically people would have thought that older couples fall into those patterns at some point. That isn't really true. What happens is after that initial limerence period and the new relationship energy and the magic carpet ride, they don't really ever take off in creating a couple sexual style that they can sustain over time, that really does suit the both of them, that works for them. For probably a lot of reasons developmentally in relationships. But sex is such a tricky thing. It's like it requires like the most skill that we have relationally, and yet we talk about it the least, and we've learned the least in a lot of ways about it. And so we don't bring our best skill to the thing that really needs our best skill. And also early in relationships like that, a lot of times people are still maybe not quite telling the whole truth about who they are and what they like and that sort of stuff. And so styles get created that maybe just aren't super compelling, ways of having sex that feel boring, and aren't, like I said, aren't that exciting and kind of easy to let go after a while. So that's one way that it works. Other ways, things are good and this couple does take off and they have 5 or 10 or 15 or 20 years of good sex, and then something happens.
It's almost more tragic.
Right. Because then it's like, where did it go? And we've had this special way of communicating and of partnering with each other that's gone now. It's like a language that they don't have access to anymore, an activity that like has made them special as a couple. It's sad. And also when sex is working for a couple, if you ask them like the top 5 reasons why they're happy, they're not necessarily going to say because we have a great sex life. It's almost like it's easy to take that for granted when it's working. But when it's not working, couples will attribute almost all of their problems to the fact that they don't have a good sex life. Like we can't decide who's going to take the trash out because we don't even have good sex. Like it's somehow all roads lead back to that when it's not working. So it's important. And And so if a woman comes in and she's sad about her desire being absent at this point, then so that's the first thing I want to do is understand, is this a problem for her? Often it is going to be a problem for her. And then I want to ask her my top 10 magic question, which is let's brainstorm right now. Let's whiteboard this. I literally have a whiteboard and I'm not afraid to use it. I say on my little colored markers, but I want her opinion on the top 10 reasons why her libido went away. A lot of times clients will come in and they'll tell me why, like because I'm in perimenopause, or because I have a thyroid problem, or because I've gained 30 pounds and I don't feel good about myself, because I'm working that extra job and I'm tired. They will tell me the reason why. And so I play along with that, and I'll admit that that's probably 95% of the problem has been identified. But let's just brainstorm the other 5. When in fact, I think usually there's some truth in what they've perceived, but that there are probably other factors that are fairly invisible to them that might be easier for us to fix. Like maybe the fact that there's something hormonally going on, or there's a medical thing, or there's something in their body or whatever that we can't really work with. That doesn't mean that all is lost. We just need to look at the other factors involved. So we start with the top 10 list and see what they come up with. And usually there are things on that list like, I'm tired. I've got too much on my to-do list. I'm mad at a lot of people. I'm sad about a lot of things. And that starts to paint a picture.
And I'm guessing that relationship issues are also on that list.
That's often that I'm mad about a lot of things is in that relationship issues piece. Yeah.
That's tough, but I do feel like you are kind of pulling back the layers.
That's
because I almost wonder, perimenopause, of course, can cause some significant barriers, but I feel like most of the women that I've worked with that have a good sex life going into it have a good sex life coming out of it.
I agree.
But potentially those that have all of these other issues, it's all of a sudden a reason to not.
Yeah.
It's sort of like calling I have a headache, and my body won't allow me to, therefore I can now have a reason to say no. And then that creates probably a bigger gulf between the couple. But
yeah, I can totally see that. And if we also kind of drop into what's often going on for women around perimenopause, what do we have? Adolescents or kids launching into the world, well or not well. Parents who are aging, well or not well. Jobs changing, bodies changing, partners maybe at a peak professionally.
And I was just thinking either probably a relationship that has aged, or if it is the end of one relationship, possibly incorporating newer relationships in that mix of life that is so busy. I really think that is probably mentally and physically the busiest time of our lives.
It's a heavy time. It is. And then to be hit, I think about just the injustice sometimes of being in a household where there are kids, like teenagers, dealing with all sorts of hormonal stuff right at the same time that mom is dealing with hormonal stuff. Like, it's like, this is
like a big joke.
It's like a big joke. Like, it's not funny. So yes. So it can be, I think, one of those where there's been a gathering storm maybe for a long time, or a lot of factors that land at once. And then all of a sudden it's not there anymore and it's not accessible and it's creating problems in the relationship. Certainly can create problems in somebody's self-image. Also, if she's always seen herself as a sexual person, to not feel that way anymore also feels like a loss.
Breast cancer just came into my head. I think a lot of women, after losing a breast, go through a stage of loss and grief, and can impact sexually as well as weight fluctuations. Yes.
Right. Those things.
Our identity can, how we see ourselves, if it's changing, can sometimes rock things. I'm trying to think through the advice that I often give someone before I would suggest that they see marriage and sex therapist, or relationship and sex therapist. Not fair to make all of these people married.
Right. They're not all married. Not everyone's married.
Or even alone. I think it can be a problem. You don't even have to be in a relationship.
That's
for it
absolutely
to be a
true.
problem. But often I will talk about making the time for yourself and to think about it. I mean, personally, I find that on my busiest day, sex is not going to cross over into my brain
Right.
very often. Whereas if I have a day or two off where I'm really spending some time allowing my brain to rest, all of a sudden it's making it's showing itself, and it
Right.
might be a song that I hear
Mhm.
or a perfume that I smell or a scene that I see, and there's a sexual thought that comes through. So I think the biggest thing is people have to find time individually and as a couple, and that's imperative, and that's assuming that there's not a major relationship problem.
Right. That I think is another important thing to be overt about, is that assumption. Because if there is, then that's a different course of treatment to sort that sort of thing out. One of my mentors loved to say that sometimes low desire is a sign of good judgment. And that sounds kind of sarcastic and snarky and whatever, but also I think sometimes there's truth in that. That goes along with the idea that not always, but that sometimes if somebody doesn't want sex, it's because the sex doesn't feel worth wanting or it doesn't feel safe to want. There's something about it that's not working really for who they are. Those are things to consider there. But what you bring up is the role even just of stress in someone's sexuality. That if we think about what we're doing when we're stressed, which is trying to survive and process quickly and do all the things we need to do when we're running from the lion, right? It's not a great time to get super in the mood.
Right.
Right, that'd be a distraction, right? We don't need blood flow going there. We don't need the distracting thoughts, right? Like during times of stress, we really need to be focused on other things. And that is often what happens, I think, in the modern world, is that our bodies still kind of do that primitive thing when in fact maybe it would be safe to want sex in the kind of stress that we're talking about. But stress management is a big piece of the work in sex therapy with helping people get their libido back, as is what you brought up around priorities. When I tell people that they're going to have to prioritize sex, I usually get pushback with like, what gives then? Like, because I'm not exactly sitting around looking for things to focus on or new priorities or whatever. My plate's feeling pretty full, which brings me to a topic I love to talk about with people, which is the idea of strategic neglect. Like, we have to have strategies in our lives for what to neglect, because we're going to have to neglect things. I don't know anybody that can get everything done. I really don't. And so then there has to be some sort of strategy for if I'm saying yes to this, I'm intentionally saying no to something else. Like if I'm saying yes to getting the carpet perfectly vacuumed every night before I go to bed, I might be saying no to time with my partner. I might be saying no to time when I could actually relax or go sit in the hot tub or go to bed a little earlier or whatever. So what do I really want to neglect? Is it the lines in the carpet, or is it those other things that I could be doing instead? So there's something, I think we've been sold a message that we really can do everything, or we should be able to do everything, but we can't.
We cannot.
We cannot. And so some acceptance around that, and then an actually like wise strategy of neglect, I think is really important. Too often, people are neglecting their sex life in service of other things that if they were conscious of it, they wouldn't do that on purpose.
And I'm sure you see that a lot when it comes to a relationship ending, people kind of lamenting and wishing that they could go back and revisit some of the choices they made along the way.
Right.
I do remember when I was starting my practice and my daughter was young, I don't think my husband and I ever had a true desire mismatch, but we had just a bedtime mismatch.
Yeah.
And we had a different way of prioritizing. For him, it was the last box he wanted to check. For me, if my head hit the pillow and sleep came into my mind, that was it. So we had to, I do remember vividly having a conversation of, you're going to have to move me up the priority list and save some of your other stuff for after I'm asleep, or it's not going to happen.
Yes.
So I got moved up. But
good. I'm glad you
it's
did.
as simple as that.
Yes, it is.
But even that, I think it was months in the making before we had that conversation, because before you're too busy. You're too
Right.
busy to sit and talk about it. If you're too busy to have it, you're too busy to talk about it.
That's right.
So interesting.
It is. And y'all were advanced because you could talk about it. There are a lot of couples that somehow have put a sex life together without ever really talking about it. And so then when it's time to talk about how to solve a problem, they have to learn the whole new skill of how do we even talk about our sex life. So that part's challenging also, but the mismatches around schedules and who needs to be in bed at what time or up at what time, who naturally wants to have sex in the evenings versus the mornings, things like that. Those kind of logistical things, they can matter a lot. I remember hearing about a study years ago where couples that don't work, they were looking at like retired couples and couples who, for whatever other reason, aren't working during the day, and found that the afternoon, so that whole afternoon delight song, like they were onto something. The afternoon is the time that a lot of couples default into having a sexual encounter with each other if they don't have all of the demands of jobs and kids and whatever. But so instead, what we do is we push sex into the margins. It's a bed activity, so it's going to happen right before bed or right when you wake up, or maybe every now and then in the middle of the night something happens. But usually what that means, like at bedtime and with waking up, we're not really at our very best then. And what people are trying to do is power down or just get going in the morning. So instead of just relaxing, now you're trying to get aroused at the same time. Like, and I know that real sexual arousal is like a nice combination of relaxation and arousal together. But still, it's an interesting thing to ask of yourself right on the cusp of going to bed. Mm-hmm. But that is the norm.
Yes, it is. And it's a bit unfortunate, and it is worth a conversation. Mm-hmm. And I think probably, I may be wrong, but I'm thinking that at least for women that have this issue come up as not an early part of their sex life problem, but later, is body image.
Yeah.
And how you help people with that issue, because I do feel like I'm not as equipped as a primary care doc to help someone manage that. And that is one that I'll tend to send to therapy.
That can really become a thing. And it's sad to see people get that wrapped up around something, because usually it's, it's sure there can be profound weight changes or profound body changes because of surgeries or things like that have happened. So scars or, like you said, breast surgery, things like that, if there's been cancer, those sorts of things. But for a lot of people, it's normal body changes of aging. In some message, they've internalized that their body isn't supposed to have those changes. Almost always the person with the issue is the person with the issue. It's not the partner. Sometimes it is. But usually that's one of the things that we end up kind of doing some reality testing around. Who is this a problem for? Sometimes that can help people to just get some reality around that. Like, this isn't actually like my partner still getting turned on.
I'm remembering a conversation with friends where you were talking to someone that was having this issue, and you were saying, now really, if you were at home naked in bed, would your husband dismiss you? And the answer was wholeheartedly no.
Right.
So back to your point of the issue is usually with the person and not with the other. So
yeah. Right. So then there's acceptance, right? The work of acceptance and the tough things that we go through around aging, I think, in general, with accepting that. I mean, not to really be a downer, but there's like a mortality piece involved with all that. Like, my body is going to change. My body's going to fall apart, and eventually it's not going to even be here anymore. Like that is involved with body image. And so, again, having some acceptance around that, doing some grief work if that's what's required. I have a friend that just did a burlesque class, and she was talking about how much crying went on during the practice sessions.
That's sad.
It's sad. She thought she just got some cute little Valentine's gift. It wasn't just a cute little Valentine's gift. These performers, these women, they were all women performers, and it was all the first time for them to go do this burlesque performance. But they and the teachers made space for it. They were prepared, but they said there's going to be a lot of grief in this room about accepting yourself at your age, accepting your body as it is, maybe saying goodbye to a body that you don't have anymore or that you never had. That there's a lot of grief in that, and they had to kind of go through that grief to be able to get to the point where they could put together a performance that felt like what they wanted to share. Mm-hmm. It wasn't optional. So for a lot of our clients, it's not going to be optional either to do that work of really making peace with their bodies.
Follow me on YouTube at Dr. Laura Beaty, where you will find MDSpin podcast. Subscribe, click the button for more health news you can use.